The impact of global warming on human health is growing at a record-breaking pace. That's according to a report out today in the Lancet Medical Journal. CBC's Marianne Demain is here with more on this story. So Marianne, what does the report say about health effects from extreme heat?
Yeah, and we are already seeing that we just came out of a very hot summer. This is a conversation that's been going on for quite some time, not only here in Canada, but around the world. And this report, now published in The Lancet, looked at 15 indicators that measure health threats. And it says 10 out of those 15 indicators are reaching alarming levels. That's the wording that this report describe this situation as. To break down the numbers, it says heat-related deaths of people 65 and over went up by 167% compared to the 1990s. It said last year we had 50 more days of health-threatening temperatures, and heat exposure led to a record $512 billion of potential work hours lost in 2023. That's 49% more above the average of 1990 and 1999, especially people who work outdoors, the people who work in construction, even agriculture. Now, when we're talking about the impact on the conditions and the weather, we know that extreme heat has led to not only droughts, but flooding. We saw the impact of climate change even on the hurricanes recently, including Hurricane Milton that just hit Tampa very recently. But when it comes to Canada, we're also seeing that in the form of a record-breaking wildfire season. And we spoke to the author of the Canadian section of this report, which will be fully released on November 1st. And she talked about how heat really has a domino effect on our healthcare system.
We know that we see increased demand on health systems in these events, emergency services, paramedics, emergency rooms, which increases the strain on these healthcare systems from a human resources perspective. We currently in Canada aren't doing vulnerability assessments of health systems yet, and it's one of the recommendations we've suggested that happen so that we know what we're up against and where the health systems are most vulnerable and how we can adapt to serve the population better.
Okay, so Marianne, if we're looking ahead, we're looking at recommendations, the ways forward, what does the report highlight in terms of signs of progress?
Well, they're also looking at communities. So we've heard so much about the calls for different industries to cut back, move to renewable energy. But here's more from that same lead author from that Canadian section of this report in The Lancet about what they're noticing in different communities across the country.
The thing is that the successes are often local and community-based. And I think that we drive success from these smaller initiatives, and it's about scaling these things. We do need government funding, and we do need policies that actually allow us to target those most vulnerable people by utilizing and taking advantage of those those smaller scale community-based interventions that we can then scale up with funding and support.
And so we'll continue to go through this report this morning and bring you more of what it says, but also, of course, the continued calls for everyone around the world to divest from fossil fuels.
Absolutely. Marianne, thank you so much for this. For more on this, we're joined now by Dr. Sejal Bhargava. She was the lead author of the Canadian section of this annual report out from Lancet. Dr. Bhargava, thank you so much for making time for us today.
Hi, good morning.
Good morning. Let me begin by asking you, how seriously is human health in the long term going to be impacted if we continue on this trajectory of climate change?
Yeah, the impacts are massive, and data continues to show that. The Global Lancet report was launched early this morning, and the Canadian report comes out tomorrow, and the statistics from the Lancet continue to be staggering. We can expect that human health is going to be drastically impacted, and we know that one of the more severe impacts come from the threat of extreme heat waves and other extreme weather events like floods and wildfires. And I think it's important that we connect these impacts from the climate to human health in order to help drive action from our policymakers.
That's interesting that you noted that the Lancet report is out today and the Canadian part of it is going to come out tomorrow. So what should we anticipate? Is it more of the same, or are there aspects of climate change and health that are distinct to our country?
Yeah, it's a great question. So we do know that Canada is impacted very much by global climate change and by the climate crisis. Canada warms at 2 times the global average, especially those impacts are felt in our Arctic. And we know that those health impacts are already being felt by Canadians in the summer months with these extreme heat waves.
Let's talk about what extreme climate, let's take these heat waves, for example. What do they do to the body? What are you seeing in terms of the effects?
Yeah, it's a great question. So, I'm a family doctor in inner city Ottawa, and I think that these impacts are felt the most by people who are more vulnerable or made structurally vulnerable in our society. And vulnerability means that they're exposed more to extreme weather events and high temperatures. They're able to adapt less, whether that be because of personal reasons like medical conditions or certain medications that they're on that predispose to feeling those really severe impacts from heat, or because they can't find air conditioning or their housing doesn't have air conditioning. And those are the people that typically fall through the cracks and end up in our emergency rooms or in our family medicine clinics with these health impacts from extreme heat. And that can look like heat stress or heat wave and heat exhaustion, heat stroke. So these impacts can be felt so deeply, and it basically causes impacts relating to dehydration and stress from heat. These impacts are felt even more in more vulnerable Canadians, like I mentioned, so people who are unstably housed, in pregnant women, in youth, in older adults. And these are the more vulnerable people that we need to look out for, especially when their personal health interacts with the social determinants of health. So reasons that they may be more vulnerable because of their surroundings.
It's so fascinating. Other socioeconomic factors that make these vulnerable communities even more vulnerable. Now, even the environment is in a way pitted against them. I'm just looking at one of the highlights from the report that's out today, specifically, as you mentioned, the elderly. And it reads that the elderly are the most vulnerable, with the number of heat-related deaths in people over the age of 65 last year reaching a level of 167% above such similar deaths in the 1990s. So just in a matter of 30 years, it's almost tripled what it used to be. I mean, so is this something that in your work as a doctor, you're making the individuals aware of, or are we trying to push policy through? Like, how do we address this?
Yeah, absolutely. And it's from both of those lenses. So in my work as a family doctor, I go do home visits and I see people who have been impacted by that. Let's say somebody's living in subsidized housing, they don't have air conditioning, and you walk into their apartment and it's 30 degrees outside and it's 35 degrees in their apartment and it's very humid, and you can tell that they're visibly struggling and they've got fans going and ice packs, but they may be socially vulnerable. They may be isolated. They may not have family and friends nearby to check in on them. And so it's important that, government and public health associations and physicians and other healthcare professionals educate the public, and that the public has access to this information to be prepared to help mitigate and prevent these health harms from extreme heat. But it's also necessary to have policy level intervention to help create housing that's more resilient, to create health systems that are more resilient, to create scaled up community-based interventions where we can target the more vulnerable people in these communities to help prevent these health impacts and deaths from extreme heat. So it's both. It's both from a personal level as well as the government and policy level. Absolutely.
Is the government level, those who are creating policies, are they listening to you, doctor?
Yes and no. We have meetings with them, and I do think they understand the urgency. But when it comes down to numbers, we have a figure of maybe $6.5 billion being invested in adaptation efforts over the last 8 years being publicly available. And the National Adaptation Strategy for Canada came out in 2023, basically is a blueprint for how to create more resilient communities and healthcare systems. And we're seeing a complete lack of funding towards those kinds of initiatives. And that's what's being called out in the Lancet Canadian report, is that we have the solutions, we know what needs to be happen, funding and programming needs to be available to help that be realized on the ground. So we do have local examples of heroes where systems are working, but it needs to be scaled up, and government intervention is lacking and lagging at this point.
And Dr. Bhargava, give us the worst case scenario. You're sounding the alarm. If the policymakers and if our governments do not react in the way that you are asking them to, then what happens?
Right. It's a matter of health equity, right? Where people who are more privileged will have the ability to adapt and stay safe and keep their families safe. But it's people who fall through those cracks, typically the more structurally vulnerable, For example, those who are homeless, those who have less of an income, people who are new Canadians who don't speak English or French, they're the most vulnerable. And I'm expecting to see that is a population that struggles the most. Our healthcare systems become overwhelmed. For example, take an extreme heat wave in combination with an electricity outage. Like, that's, in my mind, worst case scenario. And if that were to extend for multiple days or multiple weeks, the health impacts we would see are incredible. Contrast that with maybe an accompanied wildfire and accompanied flooding, because we know that these health hazards don't often happen by themselves. They often happen in sequence to one another or at the same time. And so if we don't have health systems or governments or public health, units that are given the ability to be prepared for that, I don't want to know what worst case scenario looks like, but we do need urgent intervention and urgent funding and urgent attention to both adaptation as well as greenhouse gas mitigation efforts in Canada.
Okay. Dr. Sejal Bhargava, good luck when the report, the Canadian aspect of it, comes out tomorrow. And thank you so much for making time for us today.
Thank you so much for having me.
Our pleasure.